Somebody give me, somebody tell me the
Starting in
answer.
3, 2, 1. What is up, everybody? It is your boy Jojo. Welcome to the Survive Podcast, and today I got some professionals with me. Hey, say what's up to the camera.
Hey, what's up, guys? My name is Ernest. I'm physio, working for 1 year so far.
Hey guys, my name is Nathan, also a physiotherapist. I've also been working for 1 year.
Okay, I got these guys on because I actually work with these guys. Who would have knew that, like, I've been working for like 6-7 months, and I would have met you guys, and we're on this podcast now, so that's kind of crazy. So I kind of brought you guys on today to, like, debunk. I wouldn't say debunk, but kind of, like, talk about your profession and kind of you guys just entering it, you know? Kind of the first question I have here is kind of like an update on the career so far. So let's start with, anybody want to start?
Yeah, sure. I can start first.
Yeah.
So I've been working at the same clinic I have been all year.
For about a year?
Yeah, for about a year. So I'm full-time there. I work 5 days a week. And
Busy.
yes, so my days off are Tuesdays and Saturdays, which, you know, sometimes for physios working in private practice, the work-life balance isn't always there, right? So your shifts are either morning or afternoon, and it's kind of spread out throughout the week. So I do work one weekend day, which is on Sunday, but honestly, Sundays are usually pretty chill. Sometimes new assessments, but a lot of times it's my regulars. So
I mean, you find a lot of time to kind of just do what you want to do anyway, right?
Yeah,
like, we're only
sure.
there for, I don't know how long your shift, 6 hours, right?
6.5 or 7.
Yeah,
close.
so I'm usually there for 6 hours. I know you're there for...
I work at a couple different clinics.
Okay.
At the clinic with these guys, I'm working 6.5, 7 hours.
Yeah.
At another clinic I work at, I'm working 5.5 hour shifts.
Okay, so relatively short, but we do see a lot of clients in that time. You guys are right, like 30 minutes usually, right?
Yep. Some 30s, some full-hour sessions, depending on what the client needs.
Yeah. So in that full year that you've been in, we'll start with you though.
Sure.
In that full year that you've been in so far, like, update us. Like, how's it going? Yeah, how's it going so far?
Totally. I think as a new clinician, initially it's always going to be hard to build your caseload.
Yeah.
But luckily, this clinic was very good at marketing myself, as well as
very good.
Yes, getting new clients in through the door. So I was built up to a full caseload quite early, and luckily been able to maintain that. So yeah, that's been going well so far.
Nice. And you, Ernest?
Yeah, so just a little bit about me. I've worked at 3 different clinics so far in the past year. I was working at one of them for a couple months, and then I switched over to this one with these 2 guys, and then I'm also at another clinic as well. Typically working 6 shifts a week. I double up on the Tuesdays, so I work in the mornings for one of them.
That's crazy.
Right? And then I'm working evening afterwards, and then I work Wednesday, Thursday, Friday, Saturday as well. Get Sunday, Monday off.
So as a clinician right now, are you guys up? Are you guys down? What is it?
What do you mean by that?
Like, I feel like as an RMT, like, I have my days where I'm up and my days where I'm down. Right now, it's been like a steady flow. So for you guys, what do you guys think you're at right now?
Yeah, that's an interesting take.
Yeah, because you have those clients that are just like the worst, but then you also have those clients that are like the best, and it's like you want to keep working. That gives you that motivation to continue on. Are you guys up or are you guys down?
Yeah. Ernest, you want to start?
Yeah, I can start first. I think for myself, I think as you said, Jojo, I have up days. I have down days as well. I think right now for me, the main thing I'm trying to kind of find a balance with is I'm taking a course right now on biomechanics. And I think the hardest part for me, because I'm not finished the course yet, is trying to implement what I've learned with my clients right now, and also trying to use that course knowledge to not necessarily change the way that I practice, but like just adding new skills and new kind of things to my toolbox of practicing. And so definitely there'll be some days where I have some clients where I'm like, it's a little bit tougher in the sense of like maybe the presentation is a little bit more confusing. Don't really know exactly what's going on. And then there'll be someone else that walks through the door and I'm a lot more confident with it. So I feel like for me, like, exactly. But I think for me, like within one shift, like I could have a couple of really good clients. All of a sudden there's one that kind of gets me a little bit confused. But I try not to see that as like a down, but more so like an opportunity to grow and an opportunity for learning. I think the nice part about our profession is that, we're always learning. There's always something to learn, and we're never going to know everything. And so although sometimes it's a little bit scary when you see that client in front of you and you need to, complete the session. But at the same time, like it pushes us to learn more. And so
I feel like whether it be like physio or RMT, I think our job is repetition. like that challenging client that you see. It's like if you've seen them once, you'll probably see them again, and that second time you'll probably be more ready, right? So that's a little bit of an update on your career so far, huh?
Do you want me to also give my take on that?
Yeah,
or?
go for it.
For sure. So I think looking back on the past several months, I think I've been riding a pretty steady high. But if I think back earlier when I first entered the profession, it was a lot tougher just to try to, like you guys touched on, that pattern recognition.
Yeah.
Because I think that's what's important, right? If you find a case where it keeps on presenting itself in the same way.
Yep.
If you find a few exercises or manual therapy techniques that really work out for that specific patient type, it makes the rest of your life so much easier when you see the same case, right? And
repetition.
Totally. And what Ernest touched on, taking new courses along the road, that kind of keeps your toolkit nice and fresh along the way, just so you can implement new skills, even with your regular clients that come in. If you show them something new every single time that they come in, whether it be a new technique or a new exercise, then it kind of refreshes their kind of perception on physio.
Nice. Leading up now, what was the inspiration? I mean, I guess we can start with me. I actually, right out of high school, I did 3 years of electrical. I was in a program called ACIT. So my 12th year, I started trade school, like right away. And then so I did 3 years of that. Figured out it wasn't for me. I didn't like the repetition. I didn't like the things I was doing. It was heavy. It was cold. I have that one story that I always talk about where I'm on the 27th floor working on a light fixture. And then it's like in the middle of winter. So I'm on a ladder in the middle of winter, triple, quadruple layered, still freezing. And I was like, okay, like this is not for me. Fast forward, I was like, okay, I got to find something that I really like to do. Plus being able to talk to people. I think that was one of my biggest things I wanted to be able to do. So I was like, okay, let's do a quick switch. Let's pick something. RMT seemed suitable because I liked the demographic. I like working with people. I wanted to be able to talk to people a bit better. And that's kind of the reason why I wanted this podcast, because I'm actually not a great conversationalist. But I thought I'd do something to kind of just promote me and like push me to do more. And then so I did RMT because I didn't want to do more schooling, because I'm already like, okay, bro, I got to make some money. Right?
Fair.
Right? And then, so here I am now. But the inspiration was like, being able to talk to people, and also a job where I was kind of using my body because I was used to it. Yeah.
Can I ask you a question?
Yeah, no, for sure.
Is the RMT profession kind of what you expected before going into school?
To be honest, there was no expectation. Physios, RMT, I've actually never gotten into treatment before doing RMT school. And then so I did it because a friend told me to, right? And I was like, okay, you know what? Let's give it a go. Fast forward, I did end up liking it. But now coming into the profession, if you want to like go more forward, I'm finding it like hard. Like the challenge is that it's hard to beat the stigma that RMTs are only for relaxation. You know what I mean? Like we're a overrated like masseuse, and you'll notice that like a lot of RMTs hate the word masseuse, right? Because it really degrades the profession. Yeah. Sorry, was I answering your question?
Yeah, for sure.
Yeah? Okay, and so we'll move on. Yeah. So for you guys, what was inspiration?
You can talk about yours first, Ethan.
Yeah.
Sure.
Yeah, Nate.
Okay. Yeah. So I played a lot of sports growing up, and I guess I'll go to the time when I needed a physio. So when I had my worst injury was when I was playing rugby before entering grade 8, and I fractured my tibia. So the tibia is kind of like this long shin bone over here, right? It's a pretty thick bone, pretty hard to fracture at most times.
Very hard.
However, I was growing at that time, right?
Oh, okay.
I'm not super tall, but that was like kind of where my growth spurt was.
Yeah.
And I got tackled from the side, and when my tibia broke, that was honestly the worst pain of my life.
Yeah.
But at the time, I didn't have the knowledge or the resources to rehab it properly. So I'm still kind of dealing with a few issues that stems from that original injury. Yeah. And in 2017, when I was running a half marathon, I thought, playing sports all my life, I could just do it with no training, right?
Oh my God.
So I pretty much ran it
crazy.
with no training. And then I had a lot of knee pain coming out of it, right? I could barely walk after the race. And by the end of the race, I was kind of just like hobbling along. And by like a week after, I was like, wow, this knee pain wasn't going away. I was playing volleyball and it would bother me every time I jump, every time I land. So I actually went to a physio clinic, which is a kind of like it was called Physio Room at the time, right?
Okay.
On Main Street.
Yeah.
And
Okay.
All right.
after going to physio room, I met really good physio.
Yeah.
He did a lot of like soft tissue work along the side of my leg.
Lateral
And I guess I
portion,
should have prefaced that. I used Dr. Google quite a bit. I was like,
And
man,
who
what's-
doesn't? Who doesn't?
Yeah.
Honestly.
Yeah, well, what's going on with my knee? Is my like meniscus, is it fucked up? You know, like,
And
am I,
it says cancer.
yeah,
It just goes straight to that.
like, am I ever going to be able to walk with no pain? Like,
Yeah.
should I stop playing volleyball and stuff like that? But
Yeah.
I think my physio at the time really inspired me because he showed me that with a little bit of like release, kind of aligning the tissue here, getting some of that tension away.
Yeah.
But as well as doing some of the right corrective exercises, you can actually build your body back up to be stronger than when it was before, prior to the injury.
So was that like an aha moment for you?
Yeah, totally. And I always go back to that because I was like, wow, goddamn, physio.
This guy did it.
No, physio actually works. And then
It's pretty cool.
it was inspiring too because I, as the patient, like I took ownership of it and I actually did the exercises to the T. And I was like, wow, I did what he asked and it actually worked. And I was like, this might be a career path that I want to consider in the future.
Okay. How old were you?
Yeah. I was in second year university at the time.
Okay. Yeah.
Yeah.
I think for me, a little bit different. I think coming out of high school, I actually really wanted to be a doctor. That's because my dad kind of like instilled this thought in my head, like, doctor is a great profession.
Are you? Sorry, I always forget. Like, are you Vietnamese or Filipino?
I'm Cantonese. I'm Cantonese, dog. I'm Chinese, bro.
Okay, you know what? You could pass as Filipino. I don't know if you
Could he?
I got.
No,
yes.
I'm
Yes.
a little bit dark skinned for a Chinese person.
Yes.
Really?
Yes. Farmer.
Yeah. I'm a little bit dark skinned. I'm
We're like,
definitely
you might be
more
a
tan than you.
little bit more tan. Yeah,
Oh, for sure.
Okay.
For
Yeah.
sure.
Fair enough.
100%.
Yeah. Okay. Okay. You can
but-
be seen as any of
But yeah, Chinese parents.
Yeah.
Just like he wasn't really pressuring me to become a doctor, but he just kind of instilled in my head that it's a good profession. So
Yeah.
when I got into university, I was thinking like, hey, I'm gonna take the prereqs for med school.
Yeah.
But I quickly realized just the amount of schooling that you have to go through to become a doctor, right? Like once you get into the program, 4 years,
Yeah.
another 3 to 6 years of residency before you can even start to make a living.
Yeah.
Because obviously as a resident, you don't really make too much. And
Exactly.
so I was kind of thinking about it like, why do I want to be a doctor? Like, is it what I want to do, or is it what my parents want me to do, or is it this idea that has been instilled in my head throughout my childhood that it's a good profession? And so I was in UBC Kin at that time because I was interested in the human body. And, in Kin, if it's not med school, it's PT. If it's not PT, it's OT. Like there's a couple of like paths that most people take. And so I chose the PT route. I'd gone to a physio clinic once in the past, and I was like, hey, you know what? Like working at a clinic seems pretty cool. Like seems like a pretty chill work environment.
So was that an aha moment, or when was your aha moment?
I wouldn't say that was an aha moment. I think my aha moment actually came when I was volunteering for my application for physio school. I volunteered at a senior home, and it's really different compared to what I'm doing right now. But when I got into physio school, I actually wanted to become a physio to work at the hospital, to work at a senior home. I think like my role in the senior home was just like running these exercise classes for residents there, and playing board games with them, essentially just keeping them company, giving them things to do because they obviously live there. And so I just thought it was a really meaningful job to just be able to spend time with these people and give them the help that they need, and maybe like mainly just to keep them company. I think these people, a lot of them, I guess, like I didn't see them smile too much, but like when the volunteers would come in, like I'd see some of them crack a smile, and it was kind of nice to know that I was doing something meaningful, and doing something that's actually had a good effect in the world.
Yeah, some sort of purpose.
Exactly. Yeah, so I actually wanted to go into the hospital when I first gone to school, and all throughout school actually I was thinking I was going to be a hospital physio too.
Very interesting.
Yeah.
That's completely different from my perspective because I didn't even know that hospitals had physios before I applied to physio school.
Fair.
Yeah,
I think that's
because
like the first line that people usually go to. Like
really,
yeah, hospital physio. Yeah.
I would say that like out of a graduating class, and you can correct me if I'm wrong about your class, that a lot of people go into private, right?
I would say in my class we had, I would say it's like maybe 60-40.
For
60 to private, 40 to public.
Okay, fair enough.
I would say there are more than a handful of people that are doing like a public-private split.
Okay.
So they'll do part-time at the hospital, part-time at the clinic. I think that was actually a really popular option coming out of school for a lot of my colleagues.
Which is smart. It's not
You know,
a
you
bad
get-
option.
Yeah, you get to experience like both.
Yeah.
I was considering that as well, but like just with like job searching and stuff, it didn't end up being that way.
Yeah.
So now I'm in the private world, but
Mm-hmm.
yeah, I do think that public physio work is important, it's meaningful, and yeah, it's a good job.
Nice.
Yeah.
Hell of a mouthful though. Yeah, you're going. All right, then that brings me to my next question. What is something that people don't know about physios and how they work, essentially? Or actually, let's go with what's the stigma? What did you guys figure that was the stigma as for a physio? Like for me, like at RMT, it was like a lot of people come to RMTs for just a massage, as if we're like an overrated masseuse. And which a lot of, if you ask any RMT, hearing the word masseuse is kind of like a diss. You know what I mean? Because like I went through all the schooling, learned all the things, these techniques, these kind of exercises, everything like that, and it's like all I am doing to you is just giving you a massage. You know what I mean? There's like more to it, essentially.
Absolutely. Yeah.
For you guys, what was it? What was like the stigma? Is there a stigma for physios?
I think it depends on. I mean, I wouldn't say there's a huge stigma, but if there's one that I can think of, is you only come to physio when you've had like a fresh injury type of thing, right?
That's a good
So,
one.
yeah, obviously we see a lot of clients that walk through the doors with like a fresh ankle sprain, or like, you know, some acute elbow pain. But I think if you think about a person's injury rehab timeline, that's just at the very start, right? Because sometimes we can get you to be pain-free. However, how is the rest of the body compensating for that previous injury that just happened, right? And I think if you want to take a person's care pathway throughout all the different stages of healing, yes, come in for physio with, and we'll give you some exercises or treatment for that acute injury. But there's this whole other world after we get that acute pain to settle down. How can we develop enough strength in those structures and take care of the rest of the structures just to make sure that we decrease the chances as much as possible from that happening again in the future, right?
Do you find it that do you find it hard to convince, like I wouldn't say convince, but to like inform the client that it takes more than one session to be better? Or do you have those clients where they come in and they're like, hey, like I just want you to fix me, can you fix me today?
I'm curious about your perspective on this.
Yeah,
actually.
do you have that?
Very rarely. And I think it's the way you present it on the initial session, right?
Yeah.
And I
First
think
impressions matter.
for sure.
Yeah.
And I think it's just, when I practice, I always think about like 3 different pillars, right?
Yeah.
Number 1 is education,
Yeah.
right? I gotta get the client or the patient to know what's going on.
Yeah.
As well, because if they don't know what's going on, I'm just doing my thing, giving them exercises.
Yeah.
I'm not really getting them to buy into the session at all, right? So I actually got to teach them a little bit about their anatomy, like what's the structure that's bothering you, like what's causing the pain potentially, right?
Yep.
And a few different movements that's causing their pain, and how can we, you know, minimize the pain as much as possible, but still get you to do what you love. So the education is kind of like that key piece, and then manual therapy. I'm trying to see, you know, doing a little bit of palpation, a little bit of joint mobilization, maybe a little bit of massage to try to settle down inflammation or
happening.
get things a little bit more aligned.
Yeah.
And then exercise, right? Those are the kind of like the three pillars. Yeah, for sure. And along those 3, you can actually kind of progress all 3 of them along like a continuum. Once you get them to walk through the door, you can kind of lay them out, hey, this is where we're at in terms of our journey right now. This is how we can progress it next session. And then if you get past this checkpoint, this is how we move forward. So I think that early presentation of how that trajectory is going to look like is super important.
That's a good point. I think at the start of my career, and obviously I've only been working for like a year now, but at the start I found it extremely challenging actually for myself, just because I think
Extremely challenging to
kind of have people see like
what you're seeing,
the
essentially.
longevity of what physio treatment could look like. Because I think even in my perspective too, like coming out of school, like in school we learn a lot of techniques to decrease pain, right? I think there's a lot of areas that physios can work on that just they don't have enough time to cover in school. And so coming out of that, like I think we're trained to help people bring pain down. And then from there, like, to be honest, I was lost too, like coming out of school. Like
And
I was
isn't
like,
that normal though, right?
it's definitely normal. And so I
Yeah.
think for me, like it was a learning curve for me first to be
Yeah.
like, okay, now this person is out of pain,
Yeah.
or maybe their pain is 70% better than last week.
Yeah.
Like, how do I get them back to 100%?
Mm-hmm.
Right? And like, what can I do? They're obviously relying on me as the professional.
Mm-hmm.
And so if I don't even know what to do,
Yeah.
like obviously I can't convey that, right? And I think as I've worked with more and more clients and as I've like received more mentorship, I think now I'm starting to develop that kind of knowledge for myself for like an array of different conditions.
Yeah.
And then now, since I'm kind of like taking more courses and like improving my knowledge and skill set, then I'm able to educate the clients first of all, as Nathan was talking about, which is really important. But then also knowing what I need to do to take them through.
Yeah.
And I think a lot of the times, like for me personally, like I'll find myself after the first or second session, like
Yeah.
spending like a good 5-10 minutes on each client before the session, just thinking like, what can I do with this person today? Because this is like kind of an area that's foreign to me as well.
Yeah.
And so I'm doing my own research, and obviously then I got to trial and error with the client coming in to be like, is this actually something that's appropriate for you? Or is this just something that's appropriate for someone else that's presenting similarly? And because obviously care is always individualized to the client, right?
You
And
want
so-
to cater it.
Exactly.
Yeah, to the
Exactly.
client.
So I think that's definitely something that I'm still learning to do.
Yeah.
Like after getting them out of their pain, like how do we get them back to 100% where we are not only rehabbing their current injury, but making sure that all those compensations, like Nathan, you talked about how like when you're in pain, like your body compensates for that. Like how do we get them out of those compensatory patterns and back to just kind of functioning back at 100%? So it's definitely a tougher area for me personally. Yeah.
No, that's a great point. And I think, to be honest, coming out of school, nothing beats the real life reps, right?
100%.
Yeah.
So
100%.
when clients ask you, I feel like this is like a big thing. When clients ask you, "Oh, how long have you been working?" What is your immediate answer? Like, do you have an answer? Honestly, like
Yeah.
it's been 7 months for me, so I just say 7 months.
Yeah.
But when I first initially started, I was like, yeah, like I was 2 years. It's been 2 years already, because like at school, you know what I mean? Like we learn. Like
Gotcha,
I've been treating for technically 2 years.
Okay,
You know what I
okay.
mean? Just to get them,
Fair,
because I
fair,
think
fair.
there's a whole psychological factor to that. You know what I mean? If you tell them that you've been working for this amount of time, if I said a month, they'd be like, does he really know what he's doing? Like, I don't know if I should go to him again. And it's a big factor to actually getting them back, right?
I've always been honest.
Really?
I think my very first client, I was actually
Yeah.
so nervous as I was educating her and telling her what I thought was going on.
Yeah.
And I almost thought like I almost felt like I needed to justify what I was saying. And so like
100%.
as I was
100%.
educating, I told her like, hey, yeah, you know, like I recently got out of school, you know, so like
Yeah.
I'm like really fresh in my knowledge. I know what's going on here. And so like right then
really
and
back
there,
it up.
like she knows that like, you know, like I'm a freshly graduated
Yeah,
guy,
yeah.
you know, like have no work experience whatsoever. Thankfully she booked back in, which is great.
Okay, great. That means you were doing
But
a good thing.
I do think that like I like to be honest with it.
Okay.
Just because I think I really value building rapport with the client, and I
Yeah.
think if there's something that's dishonest about what I'm saying, I think that can affect the relationship that I end
Yeah.
up building with them.
Did you think that it is a factor? Like, do you think that? Or what are your thoughts? Like, I know you went in raw. Like, you just went in like, hey, I've been training for about a week.
Yeah, yeah. Like I think I've never really thought of it in that way.
Okay.
I think a lot of times when people ask me, like obviously I try and like get a sense of where they're at. Like,
Yeah.
are they asking because they're doubting my skills? Are they asking because I gave them a really good treatment and they're like, wow, like how long have you been working, right? Because it could go the other way as well, right?
Yeah,
totally.
But like I've never really thought of it in that sense. I think like how I see it is if they value what I can provide to them, then they'll come back.
Yeah.
And obviously like there's a huge component of like in the private like physio and RMT world of like building a caseload, like getting
Yeah.
the clients buy-in, like getting them back to be like regulars, or at least like seeing them through a treatment period as opposed to them kind of like jumping around different clinicians to find their person.
Yeah.
But I think, you know, like if they don't think I'm the best clinician for them,
Yeah.
then like they're free to go and find someone else, right?
100%.
Ultimately, I want them to get better.
Yeah.
And so like I'll be honest, like, hey, if they don't like that I've only been working for a year,
Yeah.
like I can refer you to like other physios at the same clinic who've been working for 20.
Yeah.
Right?
I mean, everything is. Yeah, that's true.
Yeah. And like if they value use of experience, which is really important for some people, then like even if they continue to book with me, they're like, but this guy's only been practicing for a year. Like, does he really know what he's doing?
Yeah.
Right. And like, there's obviously a big psychological component of treatment as well.
Yeah.
Like if someone doesn't think that they're going to get better, the chances are is they might not get better. You know,
I mean, like, to be a clinician, you really need to put your ego aside. Everything's in like the client's best interest for sure, right?
For sure.
But that actually also brings me to my next question. But before we get that, let's get Nate's
Yeah,
here.
I chuckled at first because one of my mentors actually prepared me for that question before working. So this is like if a client asks you how long you've been working, right?
Yeah.
And he was said, it obviously never lied to the client.
100%.
You have to be honest. This is my first month working, my first month practicing. But then he said you could always draw upon like your prior experience. Like, I've been working as a personal trainer in the past. I was a strength and conditioning coach in the past, for example.
Dropping all these titles.
Which I thought was kind of funny, right? Like I did just come fresh out of school into this position. But the thing is, like us coming out of school, it's not like we're super unrefined professionals or anything, right? And so like for you, yes, you came out of RMT school with your previous practices in school, but you've been working out your whole life. Like you understand movement. Yeah. You understand what muscles
my own
are.
personal experience for sure.
Exactly. Yeah. And for you, Ernest, you've had all your volunteering experiences prior to entering physio school. You've had all your placements, and school has definitely prepared you to be safe. So I think new practitioners were very ready for the workspace, and sometimes it's more of like those the social interactions that may require a few more reps, right? And that once you get those out of the way, then I think it's really about just finding that therapeutic alliance with the client.
So that kind of brings me to my next question though, like, but like as a new clinician, like what are your challenges with clients though? Oh, like let's go with as a clinician, what are your challenges? I guess for me, it's like understanding that, like it's all about the perception. Do you know what I mean? Like how my client views what I did doesn't always align with how I actually saw the treatment. I feel like I've had a couple. I've had a couple of clients come in and they're like, "Oh, I want this, this, and this." I'm like, "Okay, great. We hit this, this, and this in the way that I usually like to do it." And I think that's successful because I've reached their goals. And then later on, I found out like, oh, they just weren't happy with that treatment because they weren't getting what they wanted. And that kind of aligns with like the stigma of like how RMTs are just for massage, relaxation, right? Yeah. But I guess that perception of not knowing that I'm not always doing a good job. Just because I think I'm doing a good job doesn't mean you're doing a good job, right? So like one of the challenges is just being able to be okay with the perception of what it could be or what it can't be. You know what I mean? So for you guys as like new clinicians, I guess when you were a newer clinician, what was something that you kind of found troublesome to do or seeing, and just the nature of being a physio?
I can start this one off.
Yeah.
Sure. I think in physio, you have a lot of patients coming in to you with a problem, which they think is a problem, but underlying that could be something like more systemic, right? There could be a lot of things going on. And when you think about treating a client, kind of in school, we touched on this as well. We never want to address them just based on like their physical presentation. You always want to kind of consider what's called like the biopsycho and social model. Where
they teach us in school too.
You also got to take a look at what their psychology is like, if there's any social relationship that's causing them stress.
So like, for example, like what would you be an example though for that?
Totally. So for example, like a car crash victim, for example, like they're coming in with a lot of whiplash issues, but they also can't even work. Right? They can't work. They can't put food on the table like before. They just lost their ability to drive. Like they can't get from place to place effectively. Like how does all that stress play into their neck pain, shoulder pain, and then how does that lack of sleep from all that stress built up kind of carry on to the next day and the day after that, right? I think the most difficult patients for me are the ones with the psychosocial problems as well. That's kind of layering on top of
because essentially every condition or every person that comes in, there's always layers to what they're coming in with, right?
Yes. And I think that's where the conversations are really important, whether while you're treating or getting that subjective piece, is trying to figure out like what are some other stressors that you need to address in their life. Is there any like unmet need, right? And is there something perhaps more sinister going on, right? Do they have any like systemic issues, right? That's why you got to ask all your like red flag questions. Just trying to understand your client as much as possible. And then going from there. I think when you're addressing multiple issues at the same time, that's what I find to be the most difficult.
Yeah.
And it's really about collaborating with other professionals too. When you find that you yourself as a one practitioner is not enough to give this person the best quality care, that's when you kind of refer onwards to whether it be a dietitian, OT, stuff like that.
I mean, bringing it to that, I don't know who told me this, but it might have been one of our mentors or whatever, or I might have heard it somewhere, but it was like, think of a person coming in with a condition like a painting. Like, you know those paintings, like the ones that you can do where it's like paint by number, right? And you think about every person that comes in with a condition, like it could be 5 of these things is actually, like, so say there's 100, right? 50 of these things are actually, these circles, these boxes are actually from the actual injury. And then maybe 20 of these is from like actual life stress. There could be another 20% or whatever from something else, and so forth and so forth and so forth, right? So if you look at the whole photo, it's not just that one thing that they're coming in with, but it's everything that kind of like latches on to build that picture. You guys get that? Have you heard that before?
I can imagine.
I can imagine that as well. Yeah.
And for you?
I actually want to ask Nathan a follow-up question on that. I'm curious, like, especially for people that come in with more like maybe psychosocial aspects that might be affecting their presentation. I think the psychosocial aspect of things in today's society can still be a little bit stigmatized, just a little bit. And so I'm curious how you navigate through that with your clients when you think that it might be important to refer them onwards to, let's say, a professional that might be able to help them work through those things like that. And then how you also, I guess, like, keeping that in mind, structure your session so that, for example, they might not, like, these psychosocial aspects might not be triggered during like a physio session.
Yeah,
hard question.
No,
it's a hard question.
Yeah, it's such an important question too, right? Because I think at the end of the day, you want to have a positive relationship with your client, right? So I think sometimes it doesn't take just one session for them to open up to you. Sometimes it may take multiple sessions, right? And I think one thing that I realized that every interaction that we have with the client, whether it be like, hey, I'm doing some like soft tissue work, every time we have like physical touch or these physical interactions, we're actually forming like more of a connection.
Rapport, trust.
Yeah, exactly.
Trust, essentially.
Yeah, for sure. And when the client starts to trust you a bit more, then they're able to open up a bit more about what they're experiencing in their personal lives, right? And sometimes that's really, really key. And for me, can you repeat the second part of your question again?
Yeah, just like the second part of the question, I guess, is how you kind of
refer onwards.
Yeah, like refer onwards if need be.
For sure. I think once you establish that there is a need, for example, like a simple one would be if there needs to be a dietitian that needs to that I think could help in the care of the client. I think I've got to get them to recognize that there could be a potential problem, right? And then once they're able to buy in that, oh, hey, yeah, this could actually be an issue, and there is this other professional out there other than a physio that could potentially help me, and I have the means to kind of ask for help, then I think that's probably the best solution to go about it.
Cool, man. Nice. I think for myself, in terms of challenges with the profession, I think it stems more on the business side of the profession. I think in school, during placement, like, you know, like if you have a placement at a clinic, for example, like we don't really need to find clients on our own, right? Like we have a preceptor and we are seeing our preceptor means supervisor, essentially. We're seeing their clients. And so as a student, like you go into the clinic, you got a busy day. It's like, cool. Like I'm just working. When you come out of school, like you got to start building your own caseload. You got to get clients of your own, right? And I think for me personally, like before coming out of school, because I kind of went straight from undergrad right into my master's and then kind of started working. So I didn't really have any prior experience as a kinesiologist or a personal trainer. And so this business aspect of the profession was very new to me. And so as a student, I was just used to, like, if you're at the hospital, obviously at the hospital, you know, find your own clients. But at the hospital, you got work to do. At a private clinic, you still got work to do as a student because the clients are just handed to you. But now as a professional, like, you're kind of in a way seeking out those clients on your own. Otherwise, you're out of work. And for us, we're contractors. So no work means no pay. No work, right?
No money.
And so I think that has been the biggest challenge for me coming out of it. I think I stepped into healthcare because I don't think I'm well versed in business.
Yeah.
And so it came as a surprise to me coming into the profession, like
Yeah.
realizing that, hey, like I'm not being a businessman or a salesman by any means,
Yeah.
but there is that business side of things where, you know, I'm trying to help people at the same time. If I don't see people, I won't get paid.
I mean, talking about that business side, I feel like as a new clinician too, like I find myself sometimes struggling with the idea of I might be selling. Do you know what I mean?
A little
Which
bit.
sometimes it's actually a part of the profession, but me having to change that thought process of like I'm not selling, I'm actually speaking in the client's best interest, which is why I actually, mad props to Nathan, bro. This guy comes in, out like a businessman. He finishes. I know you finish your initials with the "Here's my card." Yeah.
Always,
Like
I started doing
straight
that after I
with
saw
that.
you do it.
Oh,
I
great.
saw that.
It's-
And I'm
it's
mad
good.
props.
It's
of
good.
it. And
It's
I
good.
think
It's
you've,
really
I
good.
actually think you've somewhat mastered that kind of side of the business,
For sure.
which I think it kind of aligns with what you've been wanting to do though in this profession, right?
Yeah, I think one of my end goals is to open up my own clinic
Yep.
and perhaps have multiple locations as well.
Yep.
So with that being the end goal, which is why I chose the private route, right? Because I want to get my hands wet as soon as possible.
Yeah.
I think some of that experience with whether it be like presenting, it can come off as salesy at times,
100%.
but
Yeah.
we are speaking in the client's best interest.
Exactly.
And if
Yeah.
we're unable to sell these clients to the client, sell these sessions to the client, then that wouldn't be in their best interest. You know what I mean?
Yeah,
So
yeah.
we have to be able to get them to buy in that, hey, there is a treatment plan and let's get you on that pathway to healing. Right. So, and I really like how at our clinic we have that
Structure.
like a more of a structured plan. Like, hey,
Yeah.
at the end of the session, let's write it all down on a piece of paper. Let's give it to you so you have a physical copy
So
of what's
you
going
see
on.
it, I see it.
Yeah.
Yeah. So we're all
And
on the
he-
same ground. Yeah.
And here's my business card in case you need to email me, you know. And hey, if you want to
So
refer me
good.
to your friend because you felt better afterwards, feel free to do so, right? So
And that's why you're fully booked.
I gotta add that last comment.
Yeah.
The referrals part. Sometimes I feel like asking for referrals, asking for Google reviews. Sometimes it feels awkward for me to ask for that. Like especially like even if it's with clients that like, you know, like they feel great. I brought them from, you know, when they first came in back to 100%.
Yeah.
Like it feels like I'm almost ruining the relationship and
Relationship?
rapport that
I
have
hate asking for it.
by like asking for Google review.
Yeah.
But then a lot of times I end up being like, oh, like I still want to do it.
Yeah.
So I'll send them a follow-up email after.
Yeah.
And I'll ask for it at that point. But obviously, like, if someone were to send me an email asking for Google review, like chances are I'm probably not going to fill it.
100%. Yeah.
But like if someone like, you know, while you're closing up the session, like you ask them for it, like I feel like chances are they might. Like the probability is a little bit higher that they might fill it.
Yeah.
But for me, it just feels a little bit awkward. But I think that's a hump that I need to get over. Again, because we've been talking about like trying to not sound salesy because it's in the client's best interest.
Yeah.
But at the same time, like it's also like looking out for ourselves as well, right? Like as a clinician as well.
Like I feel like as a clinician, you really need to put aside that the idea that we're not friends. This is a business interaction. Like, you know what I mean? Like like I'm not your friend essentially. Like we can build a rapport, we can have the great conversation, but at the end of the day, I am a worker. You know, like you're coming to me for business. Like
It's still
that's
business.
business. You know what I mean?
Oh, no, I totally get what you're saying, and I think for me, like perhaps it's the kind of perspective that I have in terms of the relationship that I build with my clients. Like obviously, like I'm not gonna go and hang out with them outside the clinic, right? Like I'm not gonna do that.
No.
But at the same time, like I do feel like with some clients, like you know, you build really good rapport. You get to know them pretty well, especially people that require coming in like 1-2 times a week, right? You see them like over a span of like 3 months. Like you're seeing them like more than maybe you're seeing some of your friends,
100%,
right?
yeah.
And
So many hours of conversation.
Exactly.
So
And
many
during
hours.
during those treatments, like you're not just gonna not talk, right? Like
Yeah.
you talk about friends, talk about family, talk about your weekend.
You really open up.
Talk about your
Yeah.
work, and you know sometimes they do open up to you.
Yep.
And so I do kind of approach things at an angle of like, you know, I'm not obviously you're not my friend. We have a
Exactly.
professional relationship, but it's very very friendly. To the
It
point
is.
where
It's so hard.
sometimes
Yeah.
it can be hard for me to be like, hey, like refer your friends to me, you know, or like, hey, like,
Yeah.
could you write me a Google review? But I think like at our clinic, like with you, Nathan, and like with some of the other physios, like
Yeah.
I think they have maybe mastered that skill of like asking for Google reviews and asking for referrals, and I
it's
think
part of
that's
the job.
definitely something that I need to work on.
It's definitely part of the
Yeah,
job.
100%.
Damn, that was actually a lot. I'm actually gonna end the podcast there. Actually, yeah.
All right.
I think this podcast was definitely more informative than anything else. There's definitely a lot to talk about, but it's definitely not something we can cover in just one episode. But
Can I ask you a question?
yeah, for sure. Well, yeah. That's the last question. Yeah.
Okay. Like, where do you see yourself in the RMT profession in like the next 3 years?
Honestly, I see RMT as, and this is the hardest part because I'm starting to see it as more of I wouldn't say part-time, but it's something I do want to fall back on. I do like doing this kind of stuff, being able to have guests come on and have a conversation and just be able to do this podcast. And I do want to lean towards more social media stuff. Mm-hmm. But in terms of what I want to do with RMT, essentially in the next couple of years, I do want to learn a bit more, way more than where I am right now. And then I guess I guess every clinician's like this, but you want to aspire to open up your own clinic. Mm-hmm. So that's kind of something that I'm looking forward in the next 5 years. But for now, just being comfortable with what I do, pushing the limits, and just being the best clinician I can be. And then after that, we'll kind of see. Yeah, there isn't really set in stone. I just want to be able to know that I did it, and I did it well. Essentially, yeah.
Nice, man.
Yeah.
Mm-hmm.
Did I get to? You want to add something to that?
I'm good, man.
Okay.
Yeah.
And that was just a vibe. Thanks for listening, everybody. Leave a like, subscribe, and comment. Please press that subscribe button. And this was nice. This was Josiah. That was
Ernest.
And your boy Nate.
And then your boy Nate. And that was just a vibe. Peace.